Thomas Jefferson wrote in the American Declaration of Independence, "All men are created equal." Unfortunately, the reverse is true of fertility clinics. There is nothing equal about them. Some fertility clinics have better success rates. Some specialise in certain conditions. Some don't accept specific groups of people. And a few clinics may try to rip you off. Pick the right one and you'll have a stress-free experience and hopefully a bundle of joy. Pick the wrong one and you could put your health at risk, be out of pocket and have nothing to show for it. Given what's at stake, choosing the right fertility clinic is arguably one of the most important choices you'll ever make. But with literally hundreds to choose from, how do you make that choice? Well, at conceptionadvice.com, we've put together this guide in order to help you choose a fertility clinic that is right for you. It contains advice collected from doctors, feedback from patients, and our own personal experience with fertility treatment. So let's begin. Do you want to be treated according to a set of high standards? Is your safety important to you? If so, make sure any fertility clinic you pick is registered with an independent regulator. Regulators impose requirements, restrictions and conditions and set the standards. They police the fertility clinics to make sure they are safe and ethical. They often list all the fertility clinics in your country, along with their success rates and other useful statistics. This makes them invaluable sources of information for when you do your research. To find who regulates fertility treatment in your country, Google Assisted Reproduction Regulator, followed by the name of your country or state. Unfortunately, not every country has a specific regulator for fertility treatment. If you cannot find an independent regulator in your country, make sure your fertility clinic is at least registered with your country's Department or Ministry for Health. The first thing that most couples look at when choosing a fertility clinic are the clinic success rates. These show how successful a clinic has been at helping couples have a baby. So the obvious question is, does the clinic with the highest success rate give you the best chance at having a baby? Unfortunately, picking a clinic with the highest success rate doesn't necessarily mean to say you are selecting the best clinic for you. And because of the factors that influence success rates, you might not even be picking a good fertility clinic. So when looking at fertility clinic success rates, you also need to consider the following factors. Clinic specialisations. Some clinics specialise in treating couples with particular conditions. Because these conditions can have a naturally lower chance of success, these clinics tend to have a correspondingly lower success rate. However, if you have the condition that they specialise in, you may be better off going to the clinic to benefit from their increased expertise. Eligibility rules. Some clinics refuse to treat people with certain lifestyles or complex conditions. This can make their success rates appear to be higher than when compared to clinics that accept everybody. And if you don't meet their rules, they won't treat you either. Multiple rates. Some clinics will transfer more fertilised eggs than other clinics will. This increases the chance of an egg being implanted, but it also increases the risk of twins, triplets, quadruplets, or even more being born. This in turn can increase the risks for both the babies and the mother, so the better clinics tend to have lower multiple rates. These three factors cover possibly the most important things you should be considering when looking at fertility clinic success rates. However, there are several other factors that you may also want to consider. I go into all the factors in far more depth in a separate video called Fertility Clinic Success Rates Explained, a link to which is in this video's description. Do you have a specific condition that is preventing you from conceiving naturally? As I mentioned in the section on fertility clinic success rates, some clinics specialise in treating particular conditions. If you know why you're having problems conceiving, you might want to look for clinics in your area that specialise in treating that condition, as their experience may increase your chances of becoming pregnant. To find clinics that specialise, start by looking at clinics' websites. These will often advise you if they specialise and what they specialise in. If you can't find a clinic that specialises in your specific condition, don't give up just yet. The individual doctors and fertility practitioners that work at these clinics often specialise in particular areas. If you like the look of a certain clinic, try Googling the people who work there to see if they have specialised or written papers on your condition. If you find someone who has, you can ask the clinic if you can be seen by them. Not all clinics follow the same definition of a cycle. To quote UK guidelines, the definition of a single full treatment cycle is the replacement of a fresh embryo and subsequent replacement of all the frozen embryos derived from that cycle. What that means in practical terms is that if your first go IVF is unsuccessful and you don't become pregnant, then any embryos produced from the initial egg collection that weren't transferred can then be transferred at a later date. This should be classified as one single cycle of IVF treatment. However, some clinics may charge you for this second transfer as they claim it is part of a new cycle of IVF treatment. This is despite you not having to go through another course of drugs or having the embryos harvested again. Always ask any prospective clinics for their cycle definition in writing. This way you will have clear guidance as to what you can expect to pay for each cycle and transfer attempt. You found your perfect clinic, you've signed up with them, and now you're ready to have your baby. There's only one problem: the clinic is fully booked and can't see you for another 4 months. This is just an example to illustrate that some clinics, especially the popular ones, are busier than others. There are also busier times of year, when delays in seeing people can occur. If the timing of your treatment is important to you, then you need to check with the clinic that they have the capacity to see you immediately, or at a time that is convenient to you. Try asking them the following questions. When can I get an appointment? Will I need more tests, and how long between waits? When could you start treatment? And if applicable, how long are the waiting times for donor eggs and sperm? If you're not happy with any of the answers, you may have to rethink your choice of clinic. Is seeing the same person each time you visit the fertility clinic important to you? Well, some clinics are set up in such a way that you may see different specialists each time you visit the clinic. This is usually for the benefit of the clinic, as it allows them to be more flexible with their workforce. While this won't be an issue for some people, others may find it disconcerting. If you prefer the consistency of seeing the same person each time you visit the clinic, then you're going to need to ask the clinic if this can be done. It is also worth checking to see if your specialist has any planned leave. This is to make sure they don't disappear off on holiday for a couple of weeks during an important part of your treatment. Fertility treatment can be very emotionally challenging, so you should consider counselling to help you through the process. Some clinics provide patient support groups included with the treatment. Remember to look for this on the clinic's websites, or ask them about it when you visit them. If the clinic does not provide counselling services, do not let it put you off them too much. You can often find support groups by doing a Google search for them in your area. Remember that stress can be a factor in your chances of conceiving, and there is no shame in seeking help to overcome it. So you've found your perfect clinic, but it is not close by. Before you sign up with them, consider the following. 1. How will you travel to the clinic? What travel costs are involved? And do you need to factor these into your budget? 2. Treatments like IVF can be a very emotional experience, so travelling halfway across a country may not be in your best interests. 3. You may be required to visit the clinic regularly or during the working week, so is your job flexible enough to allow you the time off work to do the travelling involved? 4. You may feel some discomfort after treatment, so a long journey might make you feel worse. If these are a problem for you, weigh up the pros and cons before you decide to go with a clinic that is a long distance away from you. So now you know what to look out for. How do you go about putting all of this knowledge into practice? Well, the first thing you should do is write down a list of everything you personally need to consider when choosing a fertility clinic. The list should include things like working out what budget you can afford, if there is a specific type of treatment you would like, how far you're willing to travel, how could it affect work, etc. It is your personal list, so it is worth taking the time to make sure it has everything you want on it. Once you have your list of requirements, start looking up fertility clinics on the web. Using the criteria in your list, try to narrow down the selection of fertility clinics to a top 2 or 3. As previously mentioned, if your country has an independent regulator, their website can make this easier for you. Once you have 2 or 3 clinics that meet your criteria and sound good, go along to their open days to see if you like them. If they don't have open days, ask if you can have a free consultation with them. While at the open day or consultation, note down what they tell you, what you liked about them and what you didn't like about them. Then score each clinic on how you think they did. Finally, and possibly most importantly, does it feel right for you, and do you feel comfortable selecting it for yourself? Fertility treatment is very emotional, and it is important that you pick the clinic where you feel happy and relaxed. This concludes our video on how to choose a fertility clinic. Having gone through this process, you should feel happy and confident in picking a fertility clinic that is right for you. Good luck, and all the best for the future.
If you have found this video useful, please like it. And if you would like to see more fertility-related videos, check out our YouTube channel. And why not check out our website, conceptionadvice.com. Here you'll find all the latest information, help and guides. Goodbye and good luck.